Hi, my name is Andrew Ryan, and I'm a student nurse here at the University of South Alabama, and I'll be performing the medication administration checkoff. So here's my ID badge, and I'm gonna go ahead and pan the room. All right, so I'm gonna set up my camera. And all right, the first thing I'm gonna do is I'm gonna perform hand hygiene, and I'm going to check with the hospital policy about following noise interruptions, closing the door to the medication administration room, and making sure that I'm free from distractions. So I will be comparing the patient care order form with the MAR. And here's the MAR, or the medication administration record. All right, so I've washed my hands. I've made sure that I'm in a quiet room. So we have Jaguar J. Jones. Jaguar J. Jones. His medical record number is 417-6352, 417-6352. His allergies are penicillin. Allergies are penicillin. The drug is going to be, per the order, morphine sulfate. Morphine sulfate. The dose is for 5 milligrams, 5 milligrams. The route is an intramuscular injection, and the time is for every 4 hours, and the indication is for pain, PRN for pain, and the documentation is per legal prescription. And all right, so the next thing that I'm gonna do is I'm just gonna be working off my MAR. So I'm gonna set my patient order right there. So now that I have just the MAR here, I'm going to perform hand hygiene again, and I will be selecting the right vial for the medication administration, and that would be this vial. So we're picking morphine sulfate, 10 milligrams per milliliter. It has not expired. It expires 12/20/2025. And I've already washed my hands, but for the procedure, I will be using the 3 milliliter syringe, the blunt tip cannula, and then I have selected the 23 gauge and 1-inch needle. All right, so now I'm gonna go ahead and clean the alcohol, the top of the vial with my alcohol, circular motion. This can go in the trash. And then the next thing I'm gonna do is I'm gonna go ahead and get my 3 milliliter syringe. And we have calculated with another nurse and checked with them that the order is for 5 milligrams. After calculations, we are going to administer 0.5 milliliters. And so I'm going to now draw up 0.5 milliliters of air in the syringe, and I will be placing the blunt tip cannula on. That can go in the trash. And I have already cleaned that with an alcohol drop. So now we're gonna draw up our medication. All right. And I'm gonna push in the air and then flip the vial. And then I'm gonna draw back 0.5 milliliters, making sure if I had any air bubbles to tap and get them out. I do not see any. And you can always draw back and push it up a little bit. All right, perfect. So we have drawn up the 0.5 milliliters. I'm gonna put my arm behind my head back and do the scoop method and carefully press that down, because now we are going to take this off and put it in our sharps container, because we need to put on our pre-selected needle. All right, perfect. So now I'm going to do the second right of accuracy, or second rights. And so second check. So we have, the right patients. We have Jaguar J. Jones. So I'm gonna do this at the same time. Jaguar J. Jones. All right, and the right drug. So we have morphine sulfate. So I selected morphine sulfate, 10 milligrams per milliliter. So here's the correct vial. And so that is morphine sulfate. The dose is 5 milligrams, and I correctly drew up and calculated the right dosage for the patient, Mr. Jaguar J. Jones, 0.5 milliliters. So 5 milligrams. And we're doing 0.5 milliliters, which I correctly drew up. And now for the route, intramuscular. So this is the right syringe for an intramuscular injection. And the right route, and in the right time. So every 4 hours. So it's been 4 hours since Mr. Jaguar's injection. So he is in pain. This is the correct medication for his pain, morphine. So we are going to administer this now because he told me that he is in pain, and the right documentation. This is legal per the prescription, and the right, he is in pain, which is the indication. So the last indication. So PRN for pain. All right. So we are going to put this on here. I'm going to put this on here. And then now I'm going to go to Mr. Jaguar Jones's room. We're going to take our vial of medication, what we just drew up in the syringe, and our MAR. And all right, let's go. Knock, knock, knock. Hi, Mr. Jones. My name's Andrew Ryan. I'll be administering your pain medication today. How are you doing? All right, you're doing good. Let me place the MAR right here, and the medication and the vial. All right, so the first thing that I'm gonna do, Mr. Jones, I'm gonna go ahead and wash my hands. I'm gonna go ahead and put on my gloves. And I am going to check you for any pre-assessments before we administer your medication. And I also will be going to get your bed ready. So I'm gonna go ahead and lower or raise your bed to working height, and I'm going to lower the side rail. And now that I have my gloves on and my goggles, I'm going to prepare you for getting your morphine shot. So I'm going to make sure that you're comfortable, and I'm going to, we are going to, if it's all right with you, since you got your shot in the left side for your ventroglutenal, is it all right if we give it in your right? Okay, perfect. So we are going to administer this. I'm going to administer this on your right side of your ventrogluteal muscle. But the first thing I'm going to do is I'm going to go ahead and check for your wristband. So I'm going to make sure, compare the MAR. So you are Mr. Jaguar J. Jones. All right, Mr. Jaguar J. Jones, your medical record number is 417-6352, 417-6352. Awesome. And so looks like allergies are penicillin. Okay. Thank you so much. Are you allergic to any other allergies? No? Okay. So that's good. And so I will be administering this for your pain today, Mr. Jaguar Jones. And then so now I'm going to do my last check of rights, or last check of rights. So we have Mr. Jaguar J. Jones. We checked your medical record number. The morphine is the drug. So we have the drug that I just selected, the right vial, which is good. And I have it in the syringe that I just drew up in the syringe. The right dose is 0.5 milliliters that I checked with another nurse. So we did draw that up, or I did draw that up, and it is in the syringe. We are going to give this in your right ventrogluteal muscle, or right ventrogluteal muscle, and then the time is every 4 hours, and it has been 4 hours since your last injection, and you are in pain. I do not have any documentation at this time, and your indication is because you're in pain. All right, so now I'm going to go ahead and get your site clean, and so I'm going to check the surface of the skin, making sure that there's no redness or anything wrong. I'm going to clean the surface gently in a circular motion, inside out, or inside towards out. All right, and now I'm going to go ahead, have my shirts container here. So now I'm going to spread your skin, Mr. Jones. I'm going to take this off. All right, and I'm going to give you an spread your skin, and then 1, 2, 3. All right, I'm going to aspirate, checking for blood. I do not see any, so now I'm going to slowly administer the medication. All right, and quickly pull out. This is going to go into my shirts container, and I'm going to make sure that I place this on and hold it. How did you do, Mr. Jones? Are you all right? Did you feel any pain? No? Okay, good. I'm so sorry about this. All right, thank you so much. And all right, so now I'm going to go ahead and get you comfortable, Mr. Jones, and I'll be back in 30 minutes to check on you to make sure that you don't have any allergic reactions to the medication. I will be going ahead and taking off my gloves, disposing of these, and then I'm going to go ahead and wash my hands. I'm going to lower your bed to the lowest height, and I will be raising the side rail and getting you comfortable. I'm going to clean up the medication that I brought into your room and go back to the nurse's station. I will be documenting the procedure and how you tolerated it. And if you had any allergic reactions to the medication. And all right, thank you so much. And that completes the medication administration checkoff. Thank you.